Welcome back to the clinic. If you are watching this video, it means that we have both good news and bad news. The bad news is that your tests show that you do have peripheral neuropathy. Why is this bad? Peripheral neuropathy is a very serious and progressive disease that we will explain in detail here shortly. The good news, however, is that based on your exam, your nerves are still treatable, and we are very confident that we can help you. By help, we mean two things. One is minimum, stop this from progressing, and two, our goal is to reverse your nerve damage as much as possible. With that in mind, let's get started. Neuropathy is a very serious disease where the nerves outside of your brain and spinal cord start to break down. As nerves break down, they misfire, which results in tingling, numbness, pain, burning, freezing, lack of balance, muscle cramping, or hypersensitivity. Research has found that regardless of the cause, the underlying issue is a lack of proper blood flow to these areas, which in medicine is called ischemia. The reason neuropathy is so serious is that ischemia is the equivalent of a rubber band tied around the end of your finger. Now, if a rubber band is left long enough around your finger, what will eventually happen? You would likely agree that the finger would start to hurt, tingle, turn color, and eventually go numb. If it isn't removed in time, what will eventually happen to your finger? If your answer is that it will continue to get worse until you lose it, you would be correct. Without proper blood flow, the tissues cannot heal or repair and can become damaged to the point where infection can settle in, what is called sepsis, or worse yet, tissue death, which is known as necrosis. Obviously, this is terrible, and one's quality of life would suffer tremendously. Our goal is to simply lay out your treatment options. There are 3 of them. 1. Do nothing. We certainly do not recommend this option, as like any other disease, by doing nothing, your condition and quality of life will only continue to get worse with time. Your second treatment option is the typical medical route. In medicine, you will get one of 2 choices, drugs or surgery. While these are amazing options that save lives in emergencies, they are typically not the best option for chronic diseases. Drugs are meant to suppress symptoms, and you are only as good as your last dose, if at all. Surgery obviously implies amputation, which is what you and every other patient is trying to avoid. The third option is our neuropathy reversal program. We use the latest medical technology, treatments, and therapies to drive blood, oxygen, and nutrients to your nerves and tissues so that they can heal. If we can get blood, oxygen, and nutrients back to your nerves in time, they will heal like any other part of your body. And this means less pain, less tingling, better sensation, better balance, and most importantly, a better life for you. How does that sound? Now let's go over the 3 parts of our unique neuropathy reversal program. Part 1 is your at-home treatments. We use 2 medical devices, one called infrared light therapy, and one is the patented frequency our brains run on called neuroelectric therapy. These 2 devices are crucial to helping improve blood flow and rewire your nervous system. Better circulation and improved nerve conduction means your nerves and tissues will begin to heal and your symptoms will start to improve. The second part of our neuropathy reversal program is your in-clinic treatments. We use the latest technology to deliver the quickest and most effective results, which can vary from patient to patient. All of these treatments are critical to your recovery and help to decrease pain, improve circulation, improve oxygen delivery to your tissues, and address any existing nerve damage in your spine. Part 3 of your recovery is that our bodies need certain nutrients to heal. In order for you to get the best results, there are certain nutrition supplements that we will have you use that have been proven to help nerves heal and repair from the inside out. These are safe to take and will help you heal faster. In addition, you will also be using certain topicals that will help give you relief while your other treatments take hold. These will help you to feel better during the day and sleep better at night. Finally, there will be certain foods we recommend you eat and certain foods to avoid. This is not a diet, but rather a simple guideline to help remove inflammation and improve your speed of healing. This is your complete neuropathy reversal program. When we combine every one of these different approaches, the nerves will begin to heal, which will ultimately help provide our patients with lasting relief. Similar to a recipe, they are all necessary and vital to your recovery. At this point, you might be thinking, great, this all makes sense and I'm on board, but what does this program cost, and does insurance cover this? We ask that you look at our program as an investment, not a cost. Cost implies you get nothing in return, and instead we are offering to help you get your life back. We pride ourselves on transparency and are upfront with everything. Morally and ethically, we only recommend what you need to get the best and quickest results. If you can do this, you need to do this. If you cannot for some reason, we do offer a second program, which will help you get back to your goals. However, it will take longer. One of our team members will be in shortly to go through the investment with you. The next question you might have is, does insurance or Medicare cover this? As we mentioned previously, insurance only covers two things: drugs and surgery. Our approach does not use drugs or surgery, and quite honestly, most of our patients have tried those with little to no lasting relief. The fact that you are here tells us that perhaps you too have experienced minimal, if any, results from these options. The reality is that there are 0 insurance codes that we can even file with any insurance company, which means there is no coverage for these treatments and services. We do not make the rules. However, we do need to follow them. The great news is that we offset your investment more than insurance or Medicare would even consider covering. Again, one of our team members will be in shortly to go through the investment with you, and we will happily work with you to find the best solution within your budget. Our program works very well and has been the answer for thousands of patients who came in similar to you.
I was having major issues with burning feet last fall.
And I had numbness, tingling, pain in both my feet to the point where I couldn't keep my covers on at night.
You know, I was a little skeptical for it too until she put me through that exam. And then it's like, holy smokes, bingo.
But I am so glad I came. The staff here is fabulous to work with. I'm not dealing with the pain, the constant pain in my feet.
And I had troubles with my ankles due to some prior injuries that I'd had years ago. But now I don't have it. It's gone. And it's like, this is crazy.
There are a lot of people saying, we are going to help you, we want to help you, and they are helping.
I want to get as much out of this life as I can, and this has just improved. This has improved my life so much, I just can't even believe it.
It is well worth coming here.
We have created a solution to your problem based on the severity of your nerve damage, your overall health, your lifestyle, and your goals. Please know that the decision you make today will affect you for the rest of your life. We consider it an honor to partner with you on this journey, and thank you for your time. With that said, we will be in shortly to answer any questions you might have and to go through everything in detail.